Alrighty. Well, good afternoon, everyone, and welcome to this informational webinar on pre-retirement, which is hosted by U.S. Senator Bob Casey's office and the Social Security Administration. We're grateful for everyone taking the time to join this call today. I wanted to start by introducing myself and the other panelists on this call. My name is Andrea Guscott, and I am one of Senator Bob Casey's constituent advocates. Also on this call from Senator Casey's office is constituent advocate Robert Balunas. And also from the Senate Aging Committee, we have Madison Sloat joining us. And from the Social Security Administration, we are excited to introduce Richard Gaudiosi, who is Social Security's Public Affairs Specialist. We're grateful for his willingness to join our office for today's webinar. Before we get started, I will quickly note that if you have any questions, please hold them until the end of the presentation when we will have a Q&A session. We ask that you please keep your questions general and applicable to as many people as possible, since this is a public call. If you have questions regarding your own specific situation, contact information for Senator Casey's office and for Social Security will be provided during the presentation for you to reach out to directly. And at this time, I'm going to turn the call over to Richard with Social Security to delve more into the specifics.
All right, thank you, Andrea, and good afternoon, everybody. Hope you're doing well. And we're going to talk about all things Social Security, at least all the things I think you need to know if you're coming up on retirement. So there's a lot to cover. We do have an excellent website, however, in case you don't get every single thing today. We have an excellent website, socialsecurity.gov. We have our toll-free 800 number we'll talk about, and we have, of course, your local offices. So we're going to get into the PowerPoint. And we'll go for the first slide now. All right, folks, so these are the topics we're going to cover in this order. We're going to talk about you as a worker paying into Social Security, paying your taxes. You see the second bullet has taking your benefits with a question mark. That's because that's the question you're going to have to both ask yourself and answer yourself. We can give you a lot of information, but ultimately it's your money. It's your call as to when you want to take benefits. So we'll talk about the things you need to consider. We'll discuss working and receiving at the same time. A lot of people do that, collect their Social Security and continue to work. There are very specific rules that apply there. We'll talk about family benefits, specifically spousal benefits and surviving spouse benefits. And then we'll talk about Medicare. So we'll go next slide. So as a worker who's currently paying into Social Security, the Social Security tax is commonly called the payroll tax. Technically, it's the FICA tax, the Federal Insurance Contribution Act tax. And this year, people pay 6.2% of their earnings towards the Social Security trust funds, and that's helping you be insured for retirement, for disability, and family members for survivors benefits if you pass away. You pay that FICA tax on earnings up to $147,000 for the calendar year. If you're fortunate enough to make more than $147,000, you do not pay any more Social Security tax there. You also pay a Medicare tax of 1.45%, but that has no limit on earnings. Whatever a person's earnings are, then they're going to pay 1.45% of that. So a lot of people like to lump those two taxes together percentage-wise and say they pay 7.65% to Social Security, but there you see 6.2 is Social Security, 145 goes into the Medicare fund. Okay, next slide. So what do you get, folks, besides a smaller paycheck for paying those FICA taxes? Well, you're being invested for benefit down the road. So as you pay those taxes, you're earning what's called credits, and you need a certain number of credits to collect benefits later on. Working for 10 years gives you 40 credits, which is the number required to get retirement benefits. Now, in any calendar year, you can only earn 4 credits in a calendar year, regardless of how much you earn. So working for 10 years, a lot of people like to look at it that way. 10 years of work, 4 credits a year, that gives me the 40 credits I need. But you're going to see, folks, as we go through, you'd have to work a lot longer than 10 years to get a good Social Security benefit. So we'll talk about that as we get into this further. But 10 years ensures that you're due a benefit at retirement. Okay. So the big question is, when are you going to take your benefits? Now, some people know that. Some people have a firm date in mind. Others unsure. But basically, it sort of comes down to this choice. One is, are you willing to wait longer to get your Social Security in order to get a higher amount each month the rest of your life? So you put it off to get more money down the road and more money per month. Or do you say, well, I've worked long enough, I paid into the system long enough, I don't want to wait any longer, I want to collect my benefits sooner. And in so doing, you might be accepting less money because it depends on your age. But this is the rub with Social Security. Generally, the longer you wait for a benefit, the higher it's going to be, both percentage-wise and dollar-wise. The sooner you collect the benefit, the less it's going to be dollar-wise and percentage-wise. But of course, you have money in your hand, money in your pocket sooner with the second one. So this is a choice you will have to make. That's why I said in the beginning, when do you take benefits? That's a question you're going to have to ask yourself and answer yourself. Okay. If you are of a mind to wait to get more money, you will wait and put off your retirement just to get that higher benefit amount for the rest of your life. Then in order for you to receive the unreduced full 100% benefit, however you want to call it, you must wait until you reach your particular full retirement age to collect. Now, full retirement age, FRA, is determined by your year of birth. It used to be that everybody had 65 as a full age, but that has not been the case now for quite some time. So the next slide, we'll look at the retirement age schedule. I'm sorry, no, it's coming up. But if you start before your full age 62 is the earliest you can collect your own retirement, okay? However, starting early, starting before your FRA is reached, you're going to reduce the percentage of your Social Security that you receive. So the percentage can range from 70% right at 62 for some people to about 99.5% if you wait until the month before you hit your full age. It depends on what year you were born and a few other factors, but basically you have this range month to month, a different percentage. Generally, you pick up about 0.5% each month that you delay. A big consideration here is your work plans. You would like to probably get a check, but if you're working and you're making a certain amount of money, and depending upon your age, you may not be able to do that just yet. So we'll talk about that. Okay. This is the retirement age schedule I was referring to. So looking at the column on the left-hand side going down, obviously that's the year of birth. Middle column now is the full retirement age. Reading across now is the full retirement age for the corresponding year of birth. That's the age at which a person waits till to get the 100% benefit, okay? And then if you want to start at 62, which we've already said is the earliest you can start, you get a percentage there that corresponds on the line of your year of birth. Now, I highlighted people at the bottom born 1960 or later. The folks who are born exactly in 1960 will turn 62 this year. This is the first year they could be entitled to benefits, but their full age is 67, okay? And on the right-hand side, at 62, if they started this year, they were born in 60, they would get 70%. So you see where this chart is going. People are waiting longer to get percentages and dollar amounts, and that people got at younger ages in the past. But that's intentional because people are living longer, so this was the change in the Social Security regulation some years ago, okay? All right, next one. Just an example here of how this shakes out. We're going to take somebody who was born in 60, and as I said, they're 62 this year. They're due $2,500 at their full age of 67. If they start at 62, we just saw that they would receive 70% of their full benefit. So 70% of the $2,500 means they would start with $1,750. If they wait till their full age, it's a pretty easy calculation. They just would get the flat $2,500. They would get 100% benefit. So go on, next slide. But what if you delay past your full age? What if you don't take it, in this case, even at 67? Well, eventually, when you do come to us and say, start my Social Security up, you will receive 100% plus. If you don't take your benefit until after your full age is reached, you will receive an 8% yearly increase in your benefit. That is called receiving delayed retirement credits. Now, you don't have to wait a full year. It's an 8% bump up for a 12-month period. So if a person waited 6 months, they get a 4% increase and so on. That increase stops at age 70. So unless there's maybe a taxation reason to delay a little bit, there really is no benefit to delaying past the age of 70 because your benefit is not going to increase. When I say 70, I mean the month you turn 70. As far as your family is concerned, this increase is passed along only to a surviving spouse. So what that means is that if you are married and you delay your retirement and you end up getting 124% in your benefit, and your spouse is going to file on your record, his or her benefit will be computed based on your base amount, your 100% amount, not your 124%. If you pass away, that changes the calculation, and we would refigure what the benefit is for a surviving spouse. So today, if we refer to the 8% increase, we're talking about your own retirement benefit, okay? Okay, in the next slide, we'll wrap up this scenario here. So if this person delayed 3 years and started at age 70 rather than 67, they would get a 24% increase, 8% for each of the 3 years, and they would end up with $3,100. So there you see, though, the range from 62 to 70. The person on the first line starts at 62, gets $1,750 a month in his or her pocket, and they would have, in essence, a head start on the other two folks, the one starting at 67, the one starting at 70. Of course, it's the same person there. We're just doing the scenario here. But you're going to end up with more money in the long run, but you do have sort of a catch-up period where you have left money on the table. So again, you're trying to predict the future. You're trying to figure a lot of things into this and factoring into this, but that's going to be the difference. It takes a while to catch up for the money that you left on the table. Okay, next slide. So a lot of times people ask about the benefit computation. How do we figure your benefit? Well, the first thing we do is we look at all your earnings over the years, generally going back to when you were age 22, and your earnings are indexed or increased based on national wage levels. So for instance, what you made, 20 some years ago, you might get credit for double that in today's dollars, okay? Once we do this indexing for each of your years of work, and that's a good thing for you as a worker, then we take your 35 highest years to go into your computation. So remember at the outset, we said that a person needs to work at least 10 years to get Social Security. That's true. But if you only work 10 and stop, yes, you would be due a benefit, but you would have 25 years of zeros going into the computation, and that's going to lessen your benefits considerably. So that's why I say you need to work a good number of years, and you need to make a good amount of money over those years to get a good Social Security benefit, okay? Now, you probably have received over the years your Social Security statement in the mail. It's been mailed to you, and we've stopped and started this over the years, depending upon a person's age. But right now, if a person's 60 or older and have not yet taken their Social Security, they will be sent a statement every year. The only time they would not be sent a statement would be if they've created an online account. If you haven't created an account, you should be getting one of these statements if you're older. About 3 months before your birthday month. And the account I was referring to, the online account, is what's called the My Social Security account. Over 60 million people across the country have done this. This is an account which has all your personal information. You sign up online. It's a financial planning tool. It's going to give you good estimates of what your benefits could be down the road. And also for people who are already receiving benefits. Maybe you have a parent or somebody in your family who's already on Social Security. If they have an account, they can do a lot of things with that account. They could change their mailing address with us, their direct deposit information. If they need a Medicare card, they can request that. There's other things they can do. So this serves a purpose both for people who are not yet on benefits and people who are currently receiving. Okay. But if you needed to create an account, you can go to the front page of our website, ssa.gov, and right on the left-hand side, you'll see an icon for creating a My Social Security account where that red arrow is, and you would click on that, and that'll take you into creating an account. And once you have your account set up, you'll see on the next slide that the information that will be available to you depending upon your situation. Now, what I did here is I just picked out estimates for people, what they would receive if they were trying to figure their retirement down the road, sort of like the folks in the audience today. It's going to give you your benefit at your full age, at age 70, and if you're in your early 60s or so, it's going to give you what your current benefit will be. Now, there's a lot of other information on there I'm not going into here, but this is one of the big things that people want the account for, is to see what their benefits are going to be down the road. Okay? The big question, though, is when are you going to take your benefits? That's what we talked about at the outset here. Ultimately, it's personal. As I said, it's your money. You did the work. You know your family situation best. But these are all the things that a good financial planner would tell you to consider, and we tell you to consider. What is the longevity outlook for you or in your family history? Are you healthy? You feel you're going to be here for a longer period of time? You're going to be around? If you are, you may want to consider delaying your benefit. You're going to be here. Some people don't have as good of a long-range outlook, and they say, well, I paid into the system, I want to get something out of it, so they might start earlier. Taxation. Sometimes you have to pay tax on your Social Security when you receive it. So your accountant might say to you, well, Mrs. Jones, you're going to be working most of this year. If you start your Social Security simultaneously, you're going to have a tax bite. So they might tell you to put it off for next year. That's something you would have to figure into the equation. Family benefits now and in the future. Are you part of a married couple? Or are two people going to be receiving benefits? Are you a single person? Everything falls on you. Do you have children who could collect now? There's all kinds of things you need to consider there. And then on the right-hand side, finance and lifestyle, they sort of go hand in hand. Can you make it on Social Security combined with your other types of income? And your lifestyle, what do you want to do? A lot of people want to take benefits early on, and they want to travel, and they want to do certain things, and they say maybe before I get a little older and I can't do the things that I normally would do. Some people look at it that way. But all these things go into your choice. And again, back to the red line, it's personal. It's your call. We'll give you the numbers, but you have to decide. So here's one most people like to hear. When are they going to get paid? Well, you're going to get paid on a Wednesday. That's the check day for Social Security, folks. It's tied to the day of the month that you're born. If you're born on the 1st to the 10th, it's going to be on the 2nd Wednesday, 11 to 20, the 3rd Wednesday, and then people born in the latter part of the month, 21, 31, you'll get it on the 4th Wednesday. And you should be aware that the benefit that you get for a particular calendar month represents payment for the month prior. So the benefit that's received in the month of June represents your payment for the month of May. Okay, the benefits are paid the following month because the law says you must live the entire month to be due a benefit. So sometimes people find that confusing, but your benefit that you get in your hand or in your bank account on a particular month represents payment for the month prior. Okay? And we're talking about a lot of things here. I mentioned our website, ssa.gov. One of the good things, or sections, I should say, one of the good sections is our menu, which lets you, select a lot of different topics. So that's on the top of our page, and in the red arrow, retirement. So if we go to the next one, you'll see that it covers a lot of different aspects of retirement like we're talking about today. And basically you have these three columns: learn, apply, and manage. So learn is sort of what we're talking about here today, all the different aspects of the program. Apply is if you are ready to actually file your application. It gives you idea what you need to do. And then on the right-hand side would be manage. Once you're receiving your benefit, as I said, if you want to change some information with us using your account, things like that. So all the stuff we're talking about here today, you can find on our website, okay? If you were at the point where you wanted to file a claim, there's 3 ways you can do that. Generally, we tell people to begin like 6 or 8 weeks before they want to get their first check. You can file online at our website. You would access that through your online account, and you would file. It probably won't take you that long to file for a retirement. If you prefer, however, to do it either over the phone or now in office, you can set up an appointment. You would call our 800 number or toll-free number 1-800-772-1213, and they will set you up with an appointment day and time. Either you're going to be called, 10 o'clock on Tuesday morning, or you're going to be going into the office. They will set you up. So you can file whichever way is best for you. All right, so now we're going to talk about working while receiving, because this is a big factor in when people take their benefits, okay? So here we go. If you want to collect and work, but you have not yet reached your full age, so let's say your full age is 66 and a half, and you're not yet there. You're over 62, but you're not there yet. Then Social Security benefits will be withheld if your earnings exceed a certain amount of money. At full age, once you hit your full age that month, as of that month, there's no longer an earnings limit. You can make whatever you wish and collect all your Social Security. But prior to that, you're going to see we have scenarios here that you have to be mindful of, okay? If you want to start before your full age, there's 2 yearly work limits that could come into play. It depends on your age. The first limit covers several years from when you turn 62 all the way up until January of your full age year. So this could be 62, 63, 64, 65, into 66 now. The second limit applies only in your full age year, and only if you want to collect prior to your full age. So if you want to wait to your full age, none of this stuff about work limits matters to you. But if you want to start early, it does. So the second limit only applies for a closed number of months, only within your full age year. So let's go to the next slide. We'll start with the earlier limit. This is working anytime from 62 up to your full age. This year in 2022, you have a yearly earnings limit if you're in these early retirement years of $19,560. Okay, that generally changes about $500 or $600 each year. So next year it's going to be over $20,000. If you're working and you exceed that limit in earnings and you want to collect your Social Security, or you are collecting, we're going to withhold $1 for every 2 you go over that amount. So if a person makes $39,560, they're $20,000 over the limit. Half of $20,000 or $10,000 would have to be withheld from their Social Security because they made $39,560. So that, of course, impacts a person's decision. Maybe this person says, you know what, I don't want to file now because I'm losing too much money. Or maybe if it's a lesser amount that's going to be withheld, some people say, I'm okay with that. So again, that's the decision you'll have to make. Next slide. It's a whole different numbers game once you reach the year in which you hit your full age. So the earnings limit, instead of being $19,560, is $51,960 for months before your full age month. So the example here is that somebody reaches their full age in June of a particular year. In that year, from January through May, they have an earnings limit just for those 5 months of $51,960. So if they wanted to start their benefits earlier in the year before June, they would have to figure in this work limit. But it's a lot higher, as I said, than the folks who are a little bit younger. If the limit is exceeded here, the withholding is better for you as a worker. Instead of it being 1 for 2, it's 1 for 3. So let's say this person made, I don't know, $75,960, and they wanted to start before their full age month. So basically, they're $24,000 over the limit. Okay, so we would have to withhold $8,000 from their benefits if they want to start early. Now, again, depending upon how many months they have to play with here, if their birthday's in November, that's a lot different. Their earnings will be spread out over 10 months, and it might be less impactful. But if it's a short period of time, depending upon how the numbers work out. So a lot of times, if you reach your birthday early in the year, you have that high limit to work with. You could start early in a lot of cases because a lot of people are not going to make $51,960 in 1 or 2 or 3 months. But if your birthday's later in the year, you might have to contend with this. So again, this figure likewise goes up each year. So next year it'll be in probably the mid 50,000s range. Okay, we'll see. Okay. Now there's another rule about earnings, which is called the alternative monthly rule. Instead of us looking at your earnings for the whole year and trying to, unless you look at your earnings for the whole year and trying to figure out your benefits, you can do a monthly calculation where we would look at your earnings month by month and see if this is better for you. And a lot of times people use this rule in the first year they retire. You can only use this rule one time, but a lot of people use it the first year they retire. So what are the limits? Well, they're nothing more than taking the yearly limit and dividing them by 12. So the 19,000 limit becomes 1630 for younger people, and people in their full age year, instead of it being 51,960, we would look at a monthly limit of 4330. Okay, so a lot of times people, since people retire at different points in the year, sometimes they will use this. So the example here, you have somebody who's 63. And remember, if they were 63 and we were using the yearly calculation, they would have an earnings limit of 19,560. So this person, 63 years old, but this is the monthly calculation. They're going to work from January through October. They're going to make $7,000 a month. That's 10 months of earnings. That's going to be $70,000. They're not going to work the rest of the year. Now, under the yearly calculation, they're way over the 19,560, and would probably mean they're not going to get any benefits. But under the monthly calculation, the next slide will show you that this person can get paid for a few months. So because we're looking at the monthly rule, we'll say, okay, you earned $70,000 for the first 10 months of the year, but November and December, in this case, this person is not going to work at all, so their earnings are zero, so they can get full checks for November and December, and we will discount the $70,000 because their monthly earnings for November and December are 1930. So as I say, people retire at different points of the year. A teacher might retire in June, made some good money for the first 6 months, not work at all for the remaining 6 months. So that would be a situation where they would use the monthly calculation. Now, if this person next year at the age of 64 goes back out and makes $70,000, they're back on the yearly calculation because you can only use this monthly earnings rule one time. And obviously, when you come to us to retire, we will talk to you about this and see if this is a better scenario for you if you were involved with work. Okay. Okay, so our last two sections are family benefits and then Medicare. So we're going to talk here for family benefits about spouses and surviving spouses in the case of a death of a worker. So first, we're going to talk about married situations where both people are alive and well. This is a life case. The minimum age for a spouse is 62, the same as it is for retirement. A spouse can be younger, however, if he or she is caring for an entitled child of the worker who's under 16 or disabled. So let's say you had a couple, they're both 40 years old, and the husband gets in an accident and goes on disability at the age of 40. Normally, the 40-year-old spouse could not get the benefits, but in this case, they have a 10-year-old daughter in their care. So in that case, the spouse who's 40 could collect the benefit and the child could collect the benefit, okay? But in the absence of any children under 16, 62 is the minimum age for a spouse. Duration of marriage requirement is 1 year. So you have to be married at least 1 year, or if you're married for less time, you have to be the parent of the worker's child. Okay. Divorce, folks, in a life case, again, minimum age 62 if no child in care. Divorced people had to have been married for at least 10 years. So 9.5, no good. 9 3/4 of the year, no good. You have to make 10 years to be entitled as a divorced spouse. And if you're the person filing, you have to be currently unmarried. The worker could have remarried, your ex-spouse could have remarried, but you have to be currently unmarried in a life case, okay? How much do people receive as spouses in life cases? Well, the first thing is that if the filing spouse has 10 years of work in their own right, they must first file for their own retirement. And then after we figure that benefit out, we will see if they can receive any additional money as a spouse. Your age when you file for benefits determines what percentage of a spousal benefit you get. The same way your age when you file for retirement determines what percentage you get. And for spouses in life cases, the percentage ranges from anywhere from 32.5% to 35% for people filing 62. And if you're filing at your full age, you could receive the maximum benefit in a life case of 50% of the worker's full benefit. So again, from 62 on, each there's a calculation, there's a percentage change, we go up the ladder. But if you're filing in those at right on around 62, depending upon what year you were born, you know, you're looking at 1/3 to 35% or so of the spouse's full benefit. If you wait to your full age, you can get as much as 50%. Okay. Surviving spouses, when a worker passes away, minimum age there is 60 rather than 62. And also can be younger than that if you're caring for an entitled child who's under 16 or disabled. Duration of marriage in a death case is 9 months rather than 12 as it is in a life case. Or if less than that, you have to be the parent of the worker's child. You have to be single, or if you did remarry, you did it at age 60 or later. Okay. All right. How much does the surviving spouse receive? Well, if there's no minor children involved, then the range is from 71.5% at age 60, 71.5% of the deceased full benefit, up to 100% at your full age as a widow or widower. So again, each month from 60 on, there's a percentage that applies there. Okay. If the deceased took early retirement, then that lowers the benefit a little bit percentage-wise to the surviving spouse. Okay. Now, one of the things that's a available strategy for widows and widowers is that, unlike in spouse cases in life situations, a widower or widower is not required to take their own retirement first when they file for survivor benefits. Okay, remember what we said in the life case: if you have 10 years of work before you can collect spouse's benefits, you have to file for your own retirement. A widower or widower is not required to do that. So the example here, Mary becomes a widow at 63. She can say, just give me my survivor benefit only. And later, she can switch over to her own retirement anytime up to age 70, and her own retirement has grown percentage-wise. So a lot of times, surviving spouses employ this strategy. It's a good strategy if they can. Keep in mind they have the work limits to be mindful of if they're working. But a lot of times, people will take their widow or widower's benefit and then switch over later on and get a higher percentage on their own. Okay? And our last section is on Medicare. The Medicare card, you will see that the Medicare card, if we go back 1 second, the Medicare card used to have a Social Security, this person's Social Security number on it, or their spouse's Social Security number on it. That is no longer the case. As a way to combat identity theft, some years ago, Medicare agency changed the Medicare card so that if you see on the left-hand side, there's sort of this weird combination of letters and numbers, which really has no significance. If somebody loses their Medicare card, has no significance to somebody else. So they changed that a number of years back, so it's safer in terms of anybody losing their card, in terms of what could happen. Okay, go ahead. I'm sorry. Go ahead. So Medicare, of course, is the federal government's health insurance program. It is not administered by us at Social Security. It's administered by another federal agency called CMS, the Centers for Medicare and Medicaid Services. You can reach them at 1-800-MEDICARE. You do apply with Social Security to get on Medicare. We determine your eligibility. But once a person's on, all the questions about why didn't they cover this particular medical service, or something with a wheelchair, things like that, all those questions about coverage and prescriptions, those would go to 1-800-MEDICARE. Okay. There's 2 ways to qualify for Medicare. The majority of people who do qualify do it on the basis of age. That age is 65. It's been that way for forever, has not changed. It's not tied to the Social Security retirement schedule. And people who are under 65, they can also get Medicare under certain situations. They would have to be entitled to Social Security disability cash benefits for 24 months. So let's say a person goes on disability at the age of 40. At the age of 42, they would have Medicare available to them if they want it. And then folks who have kidney failure, who go for dialysis, as long as they work long enough or their spouse did, they can collect Medicare. They do not have to even be stopped working. They could be working and still collect Medicare at the same time. Okay. There are 4 parts to Medicare: A, B, C, and D. Part A is hospital insurance. This is the when you pay your Medicare taxes. We mentioned in the very beginning, this is where they go into the hospital insurance fund. This is for people who stay overnight in the hospital or overnight in some medical facility. It's premium free when you get it if you have 40 credits. But remember, you've been paying for it all the time you've been working. But if you have 40 credits of work, 10 years, then you do not pay any premium for Part A. Part B does have a premium attached to it. This is called medical insurance. This is for like outpatient types of situations. You get a test done at your doctor's office or at the hospital, and you're just in and out. You're not staying overnight. You pay a premium there, and the minimum you would pay this year is $170.10 a month. That's the standard premium. Some people who have higher income, they pay more than $170.10. So it's tied to your income. Okay. Parts C and D are the relatively newer parts of Medicare. They've been around for a while too now. Part C is what's called Medicare Advantage. You know, most people feel that just having Medicare A and B alone is not enough to cover them for all the things that can happen to them medically. So most people want some additional coverage. So Medicare Advantage offers that. There are private providers who the federal government has approved to offer this Part C plan. They offer various types of coverage, but common situation is they would offer an HMO, and usually they cover prescriptions. So in a lot of cases, you would be in a network. You would pick a private company to go with in terms of your Part C plan. Part D is the prescription drug plan. This is similar to Part C in that there's private providers who offer these plans. Social Security, the one thing we are involved in is what's called extra help. People who have limited income and limited assets and who receive Medicare can apply to get extra help with their premiums and their co-pays for a Part D plan. Okay. Part C, most of the time you see Part C covers prescriptions. So if a person has Part C, they generally don't need anything else. They have full medical and prescription coverage, but sometimes people need a standalone Part D plan. Okay. Now, sometimes people do not want to be in a network. They want to have more freedom, so they may not want Part C. In that case, their alternative is to purchase what's called a Medigap policy. This is technically called supplemental insurance. You have to have Part A and Part B, but you would purchase a Medigap policy. There are a number of Medigap policies that are offered uniformly throughout the country. So they're identified by letters, so Medigap policy K or L or whatever it might be. The policy is the same here as it is in another state, but the company you go with can charge you a different amount. So you'd have to do your homework there. And if you went with a Medigap policy instead of a Part C, then you'd have to get a standalone prescription plan. So you would buy a Part D plan. All right. Again, these are questions that would be directed to CMS at 1-800-Medicare. So now we'll finish up with your enrollment in Medicare, which is done with Social Security. But before a person does that, remember this, that Part A is premium free in most cases. Part B does have a monthly premium. And a big factor here in taking Part B is your work status. Your work status will dictate when you take Part B. We're going to talk about that as we go on here. Okay, enrolling in Part A, the hospital insurance. If you're already on Social Security, so you took early retirement, let's say 62, 63, 64, when you're coming up on 65, a card will be sent to you 3 months before your birthday month. If you want Medicare and it's going to have Part A and Part B entitlement on it, you just sign the card and keep it and you'll be covered. If you're not on Social Security, however, okay, then and nobody knows you're out there if you're not on Social Security. You would file anytime beginning 3 months before your 65th birthday month. Okay, that's the earliest you can file. You can file online at our website, or you can set up an appointment to do it by phone or in person. Okay. Enrolling in Part B is a little different because, as we said, Part B has a premium that comes along with it. So the question is, are you working or are you not working? If you're not working when you're turning 65, and also you're not covered by a working spouse, sometimes people have a spouse who covers them at their workplace. If you're not working and the spouse is not working and not covering you, then you likely need to take Part B. If you're already on Social Security retirement, we mentioned you would get a Medicare card sent to you. If you're not on Social Security, you need to file in what's called your initial enrollment period. So your initial enrollment period, again, remember, this is for folks not working. We'll talk about working folks in a second. But not working, you have a 7-month initial enrollment period. These 7 months begin 3 months before your birthday month, include your birthday month, and then the next 3 for the 7 months, okay? In this year, the month that you enroll dictates when Part B is going to start. And I say this year because there's going to be a change next year I want to mention. But in 2022, if you're enrolling in your initial enrollment period, if you enroll in any of the first 3 months before you turn 65, your coverage will start right with your 65th birthday month. If you enroll in your birthday month, then your Medicare is not going to start until the next month. Medicare B, we're talking here. If you enroll the month after 65, it's not going to start until 2 months later. And if you enroll instead in month 6 or 7 of your initial enrollment period, then it's going to start 3 months later. So your Medicare B gets pushed out depending on how, at what month you file. Now, I say in 2022 this is the case because next year there's going to be a change where whenever you enroll in the initial enrollment period, beginning with your 65th birthday month, it's just going to push out to the next month. So that's going to be a change for next year. Okay, I'm going to talk about that as well. So go forward. You're not going to get pushed out 2 and 3 months. If you miss your enrollment period this year, you have to wait until January, February, March of next year. That's called the general enrollment period. Each year, January, February, March is sort of like an open enrollment period, but it's technically called the general enrollment period. Okay? And so if you miss your initial enrollment period this year, this new rule I was referring to, the B is going to start the month after you enroll. So if you sign up in January, it's not going to start until February. If you sign up in February, it's going to start in March. If you start in March, it's going to run to April. That's a change because this year, if a person was signing up the general enrollment period at the beginning of 2022, which was months ago, their coverage would not start until July. But that's ending next year, so that changes. So you have to keep this in mind depending upon what your situation is. Sometimes people are covered for a number of months after they retire by their employer, and that could influence what month they want to file. Okay? This is my last slide. If you're working anytime from 65 on and covered by a working spouse, you can delay enrolling for Part B because you don't want to be paying for medical coverage in 2 places. You don't want to be paying money out of your paycheck or your spouse's paycheck to cover you at work or his or her workplace, and also then pay for Medicare B, which we saw is going to be at least $170.10 a month this year. So you're allowed, because you're working, and that's a key thing, you have to be actively working or your spouse does. You can push back filing for B, and then you can wait until you stop working or the coverage ends, whichever would happen first. Generally, it's when people stop working. You technically have 8 months to file. This is called a special enrollment period. But a lot of times people don't want to use the 8 months because they want the Medicare to start pretty much when the work coverage is ending. And having COBRA or retiree coverage doesn't give you extra time to file. So you can delay it as long as you're working as of the month you turn 65 and continuously doing so. Then if you come to stop, you can file with us and you're fine to get on. But that's how that's going to work. That's called the special enrollment period. So that's my last slide.
All right, thank you, Richard. for sharing that important information about pre-retirement. So now I'm going to turn the call over to Madison from the U.S. Senate Special Committee on Aging.
Thanks so much, Andrea. Hi, everyone. Thanks so much for joining us today. I will just briefly discuss about the U.S. Senate Special Committee on Aging, which some of you may know Senator Casey is the chairman of. And the committee works on all of the issues discussed by Richard today. And if we could go to the next slide. What I'll talk about just super briefly is a number of products that we produce and release. They are products, resources that can be helpful when making all of these key retirement decisions. And we also have resources on fraud prevention, which provide tips on how to avoid frauds and scams. We know that government imposter scams, those posing particularly as the Social Security Administration and as the Centers for Medicare and Medicaid Services, are both key targets for scams. And so we think that these can be helpful resources for you as well. And so all of these are available on our website at www.aging.senate.gov. You can also call us at 202-224-5364, and you can request physical copies to be mailed to you as well. And so you can take a look at all of those resources there. And I think that'll be everything from me, Andrea. Thanks so much.
All right, thank you for that information, Madison. So I am now going to provide an overview on how Senator Casey's office may be of assistance to constituents regarding Social Security issues and navigating federal agencies. Next slide, thank you. So Senator Casey's Office of Constituent Services consists of a team of constituent advocates who assist constituents who are experiencing issues with a federal agency. This includes, but is not limited to, Social Security benefits, missing passports, IRS problems, VA benefits, immigration snags, SBA concerns, and more. After receiving written permission, our office is able to follow up with the federal agency on a constituent's behalf to check on the status of pending claims or appeals, ask questions, relay information and concerns, and demonstrate Senator Casey's interest in a matter. Under the law and rules of the U.S. Senate, we cannot force a federal agency to act in someone's favor. It's also important to note that if we cannot provide assistance, such as with state or private entities, we can refer constituents to someone who can best help. Next slide, thank you. With regards to Social Security, we can assist constituents navigate the different programs within the Social Security Administration, such as Social Security Retirement, Spousal and Survivor Benefits, Social Security Disability, Supplemental Security Income, and Medicare Parts A and B enrollment. The most common Social Security cases include Social Security disability appeals or back pay, replacement Social Security cards, questions regarding a status of retirement claims, overpayments, and Medicare enrollment questions. Our office is also able to reach out to the Centers for Medicare and Medicaid Service, also known as CMS, when it comes to Medicare coverage issues and Medicare Advantage, also known as Part C, and Medicare Part D prescription drug plan issues. Common casework with CMS includes issues with claims payments, coordination of benefits, Medicare as a secondary payer, issues with Medicare enrollment and coverage of medical equipment, home health, hospital, and hospice care. Next slide. So if you would like to request assistance from Senator Casey's Office of Constituent Services, either with a Social Security question or for another issue regarding another federal agency, please do not hesitate to contact our office. You can call us at 717-231-7540 or our toll-free number at 866-461-9154. And you can also reach out to us via Senator Casey's website at www.casey.senate.gov. Alrighty, so we will now open this portion of the presentation for questions for Social Security or Senator Casey's office. If you have a question, you may click the raise hand button at the bottom of the participants list to indicate that you have a question. I will call on participants that have questions one by one and unmute you. Please note that this is a public call, so we ask that you please keep your questions general. If you have a specific issue, please feel free to contact us via the information on the screen. Alrighty, I'm not seeing any raised hands. I'll give it just a minute or two here. Okay, Edith. I will call on you. Let me unmute you. Okay, you are unmuted, Edith.
If there's an average wait time or an appropriate time to wait between submitting a Social Security application and hearing back from the agency. Thank you.
Richard, do you want to take this question?
Yeah, sure, yeah. Okay, Edith, that depends on a couple of things. First of all, I would say the type of application that was filed. Is it retirement or is it disability? And I'm assuming you're saying was filed online. Is that correct?
Yes, it is retirement and it was filed online.
Okay. Well, I mean, depending upon when you said you want to start your benefits, and if that falls in line with what shows in our records, then it might be that they just process it through, and you're going to be getting a letter pretty soon. It should happen, within a few weeks at the longest, because if everything went okay, they'll just process it through. If there's something they need to speak to you about or you need to submit, then they will contact you probably within a week's time or so to tell you that. So if it's been, more than a week, you can always contact your local office or call our 800 number and ask for status. Also, too, if you have an online account, you can see what's going on with your claim there as well. But it shouldn't be too long.
Does anyone else have any other questions? Alrighty. Well, seeing none, if you do have a question that you think of after this webinar is over, you can contact Senator Casey's office. The information is still up on the screen for you. But thank you everyone for joining us today, and we hope you have a wonderful rest of your day.